RN Prometric Exam Collection. Questions 1 to 20. Part 1. 1. A nurse is preparing to care for a client with a potassium deficit. The nurse reviews the client's record and determines that the client was at risk for developing the potassium deficit because the client 1. Sustained tissue damage. 2. Requires nasogastric suction. 3. Has a history of Addison's disease. 4. Is taking a potassium-sparing diuretic. The answer is 2. Requires nasogastric suction. Rationale: the normal serum potassium level is 3.5 milliequivalent/L to 5.1 milliequivalent/L. A potassium deficit is known as hypokalemia. Potassium-rich gastrointestinal fluids are lost through gastrointestinal suction, placing the client at risk for hypokalemia. The client with tissue damage or Addison's disease and the client taking a potassium-sparing diuretic are at risk for hyperkalemia. 2. After performing an initial abdominal assessment on a client with a diagnosis of cholelithiasis, a nurse documents that the bowel sounds are normal. Which of the following descriptions best describes normal bowel sounds? 1. Waves of loud gurgles auscultated in all 4 quadrants. 2. Very high-pitched loud rushes auscultated especially in 1 or 2 quadrants. 3. Relatively high-pitched clicks or gurgles auscultated in all 4 quadrants. 4. Low-pitched swishing auscultated in 1 or 2 quadrants. The answer is 3. Relatively high-pitched clicks or gurgles auscultated in all 4 quadrants. Rationale: although frequency and intensity of bowel sounds vary depending on the phase of digestion, normal bowel sounds are relatively high-pitched clicks or gurgles. Loud gurgles, borborygmi, indicate hyperperistalsis. Bowel sounds are more high-pitched and louder, hyperresonance, when the intestines are under tension, such as an intestinal obstruction. 3. A nurse reviews a client's laboratory report and notes that the client's serum phosphorus level is 2 mg per deciliter. Which condition most likely caused this serum phosphorus level? 1. Alcoholism. 2. Renal insufficiency. 3. Hypoparathyroidism. 4. Tumor lysis syndrome. The answer is 1. Alcoholism. Rationale: the normal serum phosphorus level is 2.7 to 4.5 mg per deciliter. The client is experiencing hypophosphatemia. Causative factors relate to malnutrition or starvation and the use of aluminum hydroxide-based or magnesium-based antacids. Malnutrition is associated with alcoholism. Renal insufficiency, hypoparathyroidism, and tumor lysis syndrome are causative factors of hyperphosphatemia. 4. A nurse is reading a physician's progress notes in the client's record and reads that the physician has documented insensible fluid loss of approximately 800 milliliters daily. The nurse interprets that this type of fluid loss can occur through 1. The skin. 2. Urinary output. 3. Wound drainage. 4. The gastrointestinal tract. The answer is 1. The skin. Sensible losses are those of which the person is aware, such as through wound drainage, gastrointestinal tract losses, and urination. Insensible losses may occur without the person's awareness. Insensible losses occur daily through the skin and the lungs. 5. A nurse caring for a client who has been receiving 4 diuretics suspects that the client is experiencing a fluid volume deficit. Which assessment finding would the nurse note in a client with this condition? 1. Lung congestion. 2. Decreased hematocrit. 3. Increased blood pressure. 4. Decreased central venous pressure, CVP. The answer is 4. Decreased central venous pressure, CVP. Rationale: a fluid volume deficit occurs when the fluid intake is not sufficient to meet the fluid needs of the body. Assessment findings in a client with a fluid volume deficit include increased respirations and heart rate, decreased CVP, weight loss, poor skin turgor, dry mucus. Membranes, decreased urine volume, increased specific gravity of the urine, increased hematocrit, and altered level of consciousness. The normal CVP is between 4 and 11 cm H2O. A client with dehydration, fluid volume deficit, has a low CVP. The assessment findings in options 1, 2, and 3 are seen in a client with fluid volume excess. 6. A nurse reviews the arterial blood gas results of a client and notes the following: pH 7.45, PCO2 of 30 mm of mercury, and HCO3 of 22 milliequivalent/L. The nurse analyzes these results as indicating which condition. 1. Metabolic acidosis, compensated. 2. Respiratory alkalosis, compensated. 3. Metabolic alkalosis, uncompensated. 4. Respiratory acidosis, uncompensated. The answer is 2. Respiratory alkalosis, compensated. Rationale: the normal pH is 7.35 to 7.45. In a respiratory condition, an opposite effect will be seen between the pH and the PCO2. In this situation, the pH is at the high end of the normal value and the PCO2 is low. In an alkalotic condition, the pH is elevated. Therefore, the values identified in the question indicate a respiratory alkalosis. When the pH returns to a normal value, compensation has occurred. 7. A nurse is caring for a client with a nasogastric tube that is attached to low suction. The nurse monitors the client, knowing that the client is at risk for which acid-base disorder? 1. Metabolic acidosis. 2. Metabolic alkalosis. 3. Respiratory acidosis. 4. Respiratory alkalosis. The answer is 2. Metabolic alkalosis. Rationale: metabolic alkalosis is defined as a deficit or loss of hydrogen ions or acids or an excess of base, bicarbonate, that results from the accumulation of base or from a loss of acid without a comparable loss of base in the body fluids. This occurs in conditions resulting in hypovolemia, the loss of gastric fluid, excessive bicarbonate intake, the massive transfusion of whole blood, and hyperaldosteronism. Loss of gastric fluid via nasogastric suction or vomiting causes metabolic alkalosis as a result of the loss of hydrochloric acid. Options 1, 3, and 4 are incorrect interpretations. 8. A client with a 3-day history of nausea and vomiting presents to the emergency department. The client is hypoventilating and has a respiratory rate of 10 breaths/min. The electrocardiogram ECG monitor displays tachycardia with a heart rate of 120 beats/min. Arterial blood gases are drawn and the nurse reviews the results, expecting to note which of the following? 1. A decreased pH and an increased CO2. 2. An increased pH and a decreased CO2. 3. A decreased pH and a decreased HCO3 4. An increased pH with an increased HCO3. The answer is 4. An increased pH with an increased HCO3. Rationale: clients experiencing nausea and vomiting would most likely present with metabolic alkalosis resulting from loss of gastric acid, thus causing the pH and HCO3 to increase. Symptoms experienced by the client would include hypoventilation and tachycardia. Option 1 reflects a respiratory acidotic condition. Option 2 reflects a respiratory alkalotic condition. Option 3 reflects a metabolic acidotic condition. 9. A nurse is reviewing laboratory results and notes that a client's serum sodium level is 150 milliequivalent/L. The nurse reports the serum sodium level to the physician and the physician prescribes dietary instructions based on the sodium level. Which food item does the nurse instruct the client to avoid? 1. Peas. 2. Nuts. 3. Cauliflower. 4. Processed oat cereals. The answer is 4. Processed oat cereals. Rationale: the normal serum sodium level is 135 to 145 milliequivalent/Al. A serum sodium level of 150 milliequivalent/Al indicates hypernatremia. Based on this finding, the nurse would instruct the client to avoid foods high in sodium. Nuts, cauliflower, and peas are good food sources of phosphorus. Processed foods are high in sodium content. 10. A nurse is assessing a client with a suspected diagnosis of hypocalcemia. Which of the following clinical manifestations would the nurse expect to note in the client? 1. Twitching. 2. Hypoactive bowel sounds. 3. Negative Trousseau sign. 4. Hypoactive, deep tendon reflexes. The answer is 1. Twitching. Rationale: the normal serum calcium level is 8.6 to 10 mg per deciliter. A serum calcium level lower than 8.6 mg per deciliter indicates hypocalcemia. Signs of hypocalcemia include paresthesia followed by numbness, hyperactive deep tendon reflexes, and a positive Trousseau's or Chvostek sign. Additional signs of hypocalcemia include increased neuromuscular excitability, muscle cramps, twitching, tetany, seizures, irritability, and anxiety. Gastrointestinal symptoms include increased gastric motility, hyperactive bowel sounds, abdominal cramping, and diarrhea. 11. A nurse caring for a client with hypocalcemia would expect to note which of the following changes on the electrocardiogram? 1. Widened T wave. 2. Prominent U wave. 3. Prolonged QD interval. 4. Shortened ST segment. The answer is 3. Prolonged QD interval. Rationale: the normal serum calcium level is 8.6 to 10 mg per deciliter. A serum calcium level lower than 8.6 mg per deciliter indicates hypocalcemia. Electrocardiographic changes that occur in a client with hypocalcemia include a prolonged ST or QD interval. A shortened ST segment and a widened T wave occur with hypercalcemia. Prominent U waves occur with hypokalemia. 12. A nurse reviews the electrolyte results of an assigned client and notes that the potassium level is 5.4 milliequivalent/Al. Which of the following would the nurse expect to note on the electrocardiogram as a result of the laboratory value? 1. ST depression. 2. Inverted T wave. 3. Prominent U wave. 4. Tall peaked T waves. The answer is 4. Tall peaked T waves. Rationale: a serum potassium level greater than 5.1 milliequivalent/Al indicates hyperkalemia. Electrocardiographic changes associated with hyperkalemia include flat P waves, prolonged PR intervals, widened QRS complexes, and tall peaked T waves. 13. A nurse caring for a group of clients reviews the electrolyte laboratory results and notes a sodium level of 130 milliequivalent/Al on one client's laboratory report. The nurse understands that which client is at highest risk for the development of a sodium value at this level? 1. The client with Cushing's syndrome. 2. The client who is taking diuretics. 3. The client with hyperaldosteronism. 4. The client who is taking corticosteroids. The answer is 2. The client who is taking diuretics. Rationale: hyponatremia is evidenced by a serum sodium level less than 135 milliequivalent/Al. Hyponatremia can occur in the client taking diuretics, the client taking corticosteroids, and the client with Cushing's syndrome or hyperaldosteronism are at risk for hypernatremia. 14. A nurse is caring for a client with acute congestive heart failure who is receiving high doses of a diuretic. On assessment, the nurse notes that the client has flat neck veins, generalized muscle weakness, and diminished deep tendon reflexes. The nurse suspects hyponatremia. What additional signs would the nurse expect to note in a client with hyponatremia? 1. Extreme thirst. 2. Decreased urinary output. 3. Hyperactive bowel sounds. 4. Increased specific gravity of the urine. The answer is 3. Hyperactive bowel sounds. Hyponatremia is evidenced by a serum sodium level lower than 135 milliequivalent/L. Hyperactive bowel sounds indicate hyponatremia. Options 1, 2, and 4 are signs of hypernatremia. In hyponatremia, increased urinary output and decreased specific gravity of the urine would be noted. 15. A nurse caring for a client with an ileostomy understands that the client is most at risk for developing which acid-base disorder? 1. Metabolic acidosis. 2. Metabolic alkalosis. 3. Respiratory acidosis. 4. Respiratory alkalosis. The answer is 1. Metabolic acidosis. Rationale: metabolic acidosis is defined as total concentration of buffer base that is lower than normal, with a relative increase in the hydrogen ion concentration. This results from loss of buffer bases or retention of too many acids without sufficient bases, and occurs in conditions such as renal failure, diabetic ketoacidosis, from the production of lactic acid, from the ingestion of toxins such as acetylsalicylic acid, aspirin, malnutrition, or severe diarrhea. Intestinal secretions are high in bicarbonate and may be lost through enteric drainage tubes or an ileostomy or with diarrhea. These conditions result in metabolic acidosis. Options 2, 3, and 4 are incorrect interpretations and do not occur in the client with an ileostomy. 16. A nurse is caring for a client with diabetic ketoacidosis and documents that the client is experiencing Kussmaul's respirations. Based on this documentation, which of the following did the nurse observe? 1. Respirations that cease for several seconds. 2. Respirations that are regular but abnormally slow. 3. Respirations that are labored and increased in depth and rate. 4. Respirations that are abnormally deep, regular, and increased in rate. The answer is 4. Respirations that are abnormally deep, regular, and increased in rate. Rationale: Kussmaul's respirations are abnormally deep, regular, and increased in rate. Apnea is described as respirations that cease for several seconds. In bradypnea, respirations are regular but abnormally slow. In hyperpnea, respirations are labored and increased in depth and rate. 17. A client who is found unresponsive has arterial blood gases drawn and the results indicate the following: pH is 7.12, PCO2 is 90 mm of mercury, and HCO3_ is 22 milliequivalent/L. The nurse interprets the results as indicating which condition? 1. Metabolic acidosis with compensation. 2. Respiratory acidosis with compensation. 3. Metabolic acidosis without compensation. 4. Respiratory acidosis without compensation. The answer is 4. Respiratory acidosis without compensation. Rationale: the acid-base disturbance is respiratory acidosis without compensation. The normal pH is 7.35 to 7.45. The normal PCO2 is 35 to 45 mm of mercury. In respiratory acidosis, the pH is decreased and the PCO2 is elevated. The normal bicarbonate, HCO3_ level is 22 to 27 milliequivalent/L. Because the bicarbonate is still within normal limits, the kidneys have not had time to adjust for this acid-base disturbance. Additionally, the pH is not within normal limits. Therefore, the condition is without compensation. Options 1, 2, and 3 are incorrect interpretations. 18. A nurse plans care for a client with chronic obstructive pulmonary disease, COPD, understanding that the client is most likely to experience what type of acid-base imbalance? 1. Metabolic acidosis. 2. Metabolic alkalosis. 3. Respiratory acidosis. 4. Respiratory alkalosis. The answer is 3. Respiratory acidosis. Rationale: respiratory acidosis is most often caused by hypoventilation in a client with COPD. Other acid-based disturbances can occur in a client with COPD during exacerbation of the disease, but the most likely imbalance is respiratory acidosis. Options 1, 2, and 4 are incorrect options. 19. A nurse reviews the blood gas results of a client with atelectasis. The nurse analyzes the results and determines that the client is experiencing respiratory acidosis. Which of the following validates the nurse's findings? 1. pH 7.25, PCO 250 mm of mercury. 2. pH 7.35, PCO 240 mm of mercury. 3. pH 7.50, PCO 252 mm of mercury. 4. pH 7.52, PCO 228 mm of mercury. The answer is 1. pH 7.25, PCO 250 mm of mercury. Rationale: atelectasis is a condition characterized by the collapse of alveoli, preventing the respiratory exchange of oxygen and carbon dioxide in a part of the lungs. The normal pH is 7.35 to 7.45. The normal PCO2 is 35 to 45 mm of mercury. In respiratory acidosis, the pH is decreased and the PCO2 is elevated. Option 2 identifies normal values. Option 3 identifies an alkalotic condition. Option 4 identifies respiratory alkalosis. 20. A nurse is caring for a client who is on a mechanical ventilator. Blood gas results indicate a pH of 7.50 and a PCO2 of 30 mm of mercury. The nurse has determined that the client is experiencing respiratory alkalosis. Which laboratory value would most likely be noted in this condition? 1. Sodium level of 145 milliequivalent/L. 2. Potassium level of 3 milliequivalent/L. 3. Magnesium level of 2 mg per deciliter. 4. Phosphorus level of 4 mg per deciliter. The answer is 2. Potassium level of 3 milliequivalent/L. Rationale: respiratory alkalosis is defined as a deficit of carbonic acid or a decrease in hydrogen ion concentration that results from the accumulation of base or from a loss of acid without a comparable loss of base in the body fluids. This occurs in conditions that cause overstimulation of the respiratory system. Clinical manifestations of respiratory alkalosis include headache, tachypnea, paresthesia, tetany, vertigo, convulsions, hypokalemia, and hypocalcemia. Options 1, 3, and 4 identify normal laboratory values. Option 2 identifies the presence of hypokalemia.